So for ankle taping, as with any tape job, we want to be sure we understand the rationale for why we're doing the tape job. In this particular case, we're looking to help the patient prevent plantar flexion and inversion positioning of the ankle. We want to make sure that the patient has been evaluated by an athletic trainer to be sure that this is the proper technique for this patient. Also want to be sure that we ask the patient if they've ever been taped before, ask them if they have any allergies to latex or any of the spray that we're going to use. Want to be sure that we're looking for any open wounds on the ankle before we begin the tape job, make sure we cover those if they have those. We want to be sure that we are positioning the patient in a dorsiflex position and ask the patient to hold this position throughout the tape job. So the first thing we want to do is start out with the adherent spray, making sure we give just a nice little mist around it, hopefully allowing the tape to adhere a little better to the skin, provide more stability for the tape job. And then move into the heel and lace pads. We're just going to put those on the anterior and posterior side of the ankle, help prevent any excess rubbing and hopefully prevent blisters from occurring. The pre-wrap is the next step. You want to be sure that you are applying just enough pre-wrap. You're going to overlap it a bit and then work your way up, but not too much. Too much pre-wrap then compromises the stability of the tape. So we're going to start with the anchors, just at the base of the calf. Want to do 2 of those anchors. Proximal end are going to kind of angle upward to prevent any gapping. And then one at the lower end. Want to be sure that we're being careful of the 5th metatarsal on the outside so that we don't impinge that at all. Anchor. We're then going to move on to the stirrups themselves. You're going to use the malleoli as a guide. So the medial malleoli, first one should be just posterior to that medial malleolus. Want to make sure we're pulling up on the lateral side to prevent that inversion from occurring. So really giving some lateral support to the ankle by pulling up on the lateral side. The next step is to move into the horseshoes. We're going to, again, use the malleolus as a place to position it, just inferior to the malleolus is the first one. This interweaving of the stirrups and the heel locks provides a little bit of stability to the ankle joint. The second stirrup is going to be just directly on the malleolus, on both the medial and lateral side, again, pulling up on the lateral side. And then the second horseshoe is going to be right over top of the malleolus. This interweaving is called a basket weave, and it's not necessarily required, but it is helpful to provide some extra stability to the ankle tape job itself in that area where there tends to be the injury that occurs. We want to then apply another anchor that just helps to hold those stirrups that we've just applied, helps hold those down. So we'll finish off with 3 horseshoes and 3 stirrups to be sure that we have a nice base. Figure 8s, you're going to go from the medial down on the medial side and up on the lateral side to help that prevent the inversion from occurring. There's a bottom half and a top half of the 8, making a nice X over the anterior side. So here's the bottom half of the 8 around the base, looking for any wrinkles, and then the top half of the 8. Rip there. We're going to move next into the heel locks themselves. You can continuously go from figure 8 to heel lock if you prefer. You're going to, again, go down on the medial, up on the lateral side to lock in the lateral part of the heel. Being careful of the Achilles, you don't want to pull too tightly across there to pinch that. Then you're going to come down on the medial side to lock in the medial heel. Up and across and end. We'll do 1 more of those. We're doing 2 figure 8s and 2 heel locks. If you may need to do a little bit more depending on the need for that patient if they need more stability. But 2 is the minimum. Again, providing lots of room with the tape. And I'm going to close off. Choose to close off from the proximal to the distal end. Helps to keep the exposed ends to a minimum as they put their sock on. Want to be sure you're checking for any open spots that may create blisters. Should be a little spot at the back of the heel that's open, but the rest of it, you want to be sure that you have it nice and closed. Then you want to test it to be sure it's comfortable for the patient, not too tight. And the next step would be to have them step down and test it functionally.